usual, your host is Nas Dennis. Welcome back again. I hope you're fine and you're doing well. So today I want to discuss something about how to calculate your safe days and to know your fertile days, and also, most importantly, your ovulation days. So if maybe you have a partner and you want to get pregnant, or sometimes you want to avoid pregnancy, it's always better to know safe days so that you can play around those days. So if you are joining me, kindly let me know where you're joining me from. And also, you can comment down below in the comment section. If you have any question, you ask. Hey, hello, Miss Judy. How are you? Yes, I'm happy to see you today. I hope you are doing fine. Yeah, thank you so much for always being there. I'm very fine. I'm very fine. Did you go to job? Thank you. Thank you so much, Miss Judy. Yeah, thank you. Thank you so much for your support. I appreciate so much. So today I want to talk about how to. Oh, you are in the hospital. Where do you work? Or where do you work? Which hospital? Are you in Nairobi? Oh, that's cool. Hope I'll see you one day. Yes, I appreciate so much. Thank you, Miss Judy. Yeah, thank you. We will. You shall one day, God willing. So today I have my board here. This board will help me explain for you guys how to calculate your safe days. Yes, thank you. I'm very happy for you to have joined me. Thank you for taking your time. Even though you are in the hospital, you are busy, but at least you found time to join me live. Thank you. I appreciate so much, Miss Judy. Yeah, so it's always very important to know your safe days, because I found out that many people, I don't know, is it myths? Yeah, thank you. Share me out, guys. Those who have joined me, share me out. Yeah, I appreciate. Share me out to your friends. Yeah, thank you, Miss Judy. Let me log in so that I can catch up with you in the comment section. I have my laptop down below here, so let me just allow me to log in, and then I can respond to your text messages. Yes. Just bear with me. Allow me log in that in a little while. Then I catch up with you guys. Yes, so first, if you want to know your safe days, these methods are the estimate. There is no absolute safe days. First, you need to understand that there is no absolute safe days. Why am I saying that there is no absolute safe days? Because it normally varies and changes with, it can change with time. It can also, maybe you can be physiologically unwell, maybe you are sick, maybe you've also changed the environment. So if you change your environment, your cycle can also change. Remember, for you to estimate your safe days, you must have a regular period. Your cycle must be regular. For example, if you are seeing your menses after, let's say, 28 days, it must be after 28 days. If it is 30, then it must be after 30 days so that you can be able to be sure of this method. But if you have irregular menses, then it will be very difficult for you to know your cycle. So this one, kindly, you have to monitor your cycle. And for you to monitor your cycle, at least you might have you should have monitored it for around 6 months, 6 consecutive months. So monitor your period for 6 consecutive months. When you start seeing your period, that is your first day of your cycle. And the moment you see your period, that is your first day. So mark that day, count it until the next time you see your next period. So those days between, you mark and count them. And then you wait for another period, count this, do the same until you be sure that you have a specific number of days in your cycle. First, you must monitor your cycle so that you'll be able to understand whether you have regular period or irregular period. Irregular period, these people, they see their menses on different occasions. You can see your menses on after 23 days, after 31 days, after 26 days. So that is very irregular. So you are not able to follow up and be sure that you have regular menstrual period. Or you can use this and be sure that you have specific days as your safe days. So you have to understand my disclaimer that this one is for those who have regular menstrual period. And for you to know that, you have to monitor it for at least 6 consecutive months. So if you are joining me, kindly let me know where you're joining me from so that I can recognize you. And in case you have any questions, you kindly ask me in the comment section. I will respond to you. Anything pertaining your cycle. If you have any problem in your menstrual cycle, you can kindly join me and let us learn together. Also, if you are new to this channel, I normally give health talks on different topics so that we be aware of our health. So kindly support me by subscribing to my channel and always watch my video, guys. If you're joining this live, kindly don't leave. Give me a thumbs up and let's connect and know each other. So first, you'll have to for you to know your safe days, you must know your ovulation day. What do you mean by ovulation day? So ovulation day, for example, we have sperms from the male gender and ovum from the female gender. So ovulation is that process of release of an ovum from the ovary. So every month, ladies release ovums. That process of ovulation takes place in women. They release ovum from either of the ovaries. They normally have 2 ovaries, the left one on the left side and on the right side. So these ovaries, they produce ovum on different occasions. So some individuals can ovulate from both sides, from both the left and right sides. but majority release egg from one ovary alternately. So if the left side releases an ovum this time, maybe next time the other one will release. But in some people, they ovulate from 2 ovaries. So you have to understand first your ovulation day. That day which you release ovum from your ovary. So I want to use, we have a standard. If you see your menses between 21 days and 35 days, that is the normal. If your period, the length of your cycle is between 21 days and 35 days, you have normal cycle. So some people see their menses between 21 days, some at 25, some at 27, some at 35. So that is called the normal length of a cycle. Normal length of a cycle lasts between 21 and 35 days. Now the average, where majority see their menses, is at 28 days. So majority of ladies see their menses after 28 days. Majority of ladies see their menses after 28 days. This is the average. But if it is between 21 to 35, that is normal. If you are seeing your menses between 21 days to 35 days, that is normal. But if it is between, if it is 28, that is the average where most ladies have their menses. So if you have 28-day cycle, for example, if you have 28-day cycle, when is your ovulation day? Ovulation day, that is the day where you are the most fertile day in your cycle, the ovulation day. So if you want to be pregnant, then you must have sex around that day, your ovulation day. That is the most fertile day in your cycle, ovulation day. That is why I'm very determined to help you know when are you ovulating. You must know when are you ovulating. So you are ovulating at 20. You are ovulating. Okay, sorry. If you have a 28-day cycle, then you are ovulating on day 14th. If you have 28-day cycle, you are ovulating on day 14th. Okay. What happens is that after ovulation, you take 14 days to see your menses. After ovulation, you take 14 days to have your menses. So if you are having a cycle of 28 days, then the 14th day is the day you are ovulating. So that you take 28 days. Okay, Miss Judy, this one I bought at, this one was around 350. This one is a cheap one. It's a bit shorter. Yeah, it's not expensive, around 350. You can have one. Thank you. So if you have 28-day cycle, you are ovulating on day 14th. So for you to know day 14th, you must, yes, I bought it from a friend. But I'll connect you. I'll connect you so that you also have one. Yeah. Yeah, I will connect you. So I'm saying that kindly, if you are joining me live, kindly give me a thumbs up and let me know where you're watching me from. So I've said that after ovulation, you take 14 days to see your menses. And remember, 14th day from the time you ovulate, you will see your menses. That's why if you have 28 days, the day of ovulation becomes the day 14th. So that if you add another 14 days, if you have another 14 days, you have 28 days. You want me to have you get your contact, or which contact are you talking about? Thank you for sharing. Thank you for sharing. So I'm writing so that you get it, and I will delete it immediately. So once you see it, I will delete it. So acknowledge so that I know. Yeah, that's the WhatsApp contact. Yeah. Yeah. Hope you have it already. Okay, thank you. Yeah, good. Now I can continue. So thank you so much. Now I was talking about your ovulation day. So you ovulate on day 14th when you have 28-day cycle. When is your ovulation day? If you have day 21. So for those who have the 28-day cycle, remember you ovulate on your 14th day. Let me also explain to you, what if you have a different cycle. For example, you have 21-day cycle. If you have 21-day cycle, remember from the day of ovulation, you see your menses after 14 days. So if you have 21-day cycle, it means that your ovulation day is day 7th. So that after 14 days, which is after 21 days, you see your menses. So if you have 21-day cycle, let's agree that your ovulation day is day 7th. So these are individuals that they can, they can be pregnant, or they can get pregnant while they are still seeing their menses. For example, if you are seeing your menses for a longer period, for example, for more than 1 week, and you have 21-day cycle, you can still be pregnant while you are still seeing your menses, because you have a shorter cycle. When you have a shorter cycle, your ovulation days tends to be earlier than the rest. Okay. What about if you have, for example, let's say 26-day cycle. If you have 26-day cycle, you have to take 14 days from 26 and get 12. 14 from 26, 12. So the 12th day is your day of ovulation. Likewise, so if you have any cycle, you subtract 14 so that you get the day of ovulation. So you count your cycle from the date the first day you saw your menses to the next time you see your menses. So you subtract 14 from the length of your cycle so that you get the day of ovulation. Miss Judy, I hope you also getting my point. I hope you've understood also the day of ovulation. So if you have understood, acknowledge it so that we can continue. I want to move with everybody. Let us all understand our day of ovulation, because that is the most fertile day. That if you want to be pregnant, play around that area. If you don't want to be pregnant, avoid having unprotected sex around that day. Yes, so after knowing your day of ovulation, it is also very important to know. It is also very important to know the lifespan of an ovum and the lifespan of sperms. Remember, ovum, the lifespan of ovum is between 12 to 24 hours. An ovum is only viable for 12 to 24 hours. Yes, ovum is only viable between 12 to 24 hours. And then the lifespan of sperms is what varies. Sperms have longer lifespan than ovum. Sperms can live between 3 to 5 days. Sperms can be viable between 3 to 5 days, while ovum is viable between 12 to 24 hours. So you see, the sperms have longer lifespan than the ovum. So that's why it is very, very important to know the ovulation day, because ovum is viable for a very short time, while sperms can live up to maximum of 5 days. So let's take, for example, you have a 28-day cycle. If you have a 28-day cycle, your ovulation day is day 20, day 14th. Now, let's take a random date. So that you understand how you can know your safe days. So after knowing your ovulation day, and you know already that ovum is viable or will only live for one day, 24 hours maximum. That is between 12 hours to 24 hours maximum. Then you have to avoid sex or have sex around that period if you want to be pregnant or avoid pregnancy. So I'm taking, for example, if you have a 28-day cycle, so that your ovulation day is day 14th. What is your safe, or when are your safe days? If you have ovulation day on day 14th, depending on when you started menstruating, I don't know when. We have different months. Depending on when you started seeing your menses, you count until day 14th. That day is when you are ovulating. And remember that ovum is alive for 12 to 24 hours. And sperm can live up to 5 days, 3 to 5 days. So when are your fertile days and safe days? So your fertile days is days around this day of ovulation. Your fertile days are days around your days of ovulation. So you have to count your day of ovulation. Add 2 days. We want to know your fertile days. Add 2 days after your day of ovulation, and also subtract 5 days from your day of ovulation. So 5 days, that is 13th, 12th, 11th, 10th. 1, 2, 3, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And you add 2 days from your days after ovulation. So this period here, 5 days to ovulation. Remember, your ovulation day is day 14th. Day 14th, any day day 14th, depending on when you started seeing your menses. 5 days to your days of ovulation, and 2 days after ovulation, that is your fertile days. Miss Judy, if you are with me, kindly acknowledge so that I know that you've understood this point. Your fertile days is 5 days to ovulation, and add 2 days after ovulation. So that period, for example, 2 days, that is 15th and 16th. So from 10th to 16th day, that is your fertile days. So if you have sex between that period, you are increasing your chances of being pregnant. Remember, your chances of being pregnant is increasing as you move towards the day of ovulation. Your chances of being pregnant increases as you move towards your day of ovulation. And a day, at least 1 or 2 days after ovulation. So that period, this period between 5 days and 2 days after ovulation, that is your fertile days. So it means that from the day you start seeing your menses to 10th day of your cycle, that is your safe days. Pre-ovulation, from the first day you see your menses to the 10th day, that is your safe days. And post-ovulation, 2 days after your ovulation day to the next time you see, the next date you see your menses, that is also your safe days. So having sex during that time in your safe days reduces your chances of being pregnant, even if you do unprotected sex, that is unprotected sex. I'm going to explain this. I'm going to repeat this so that you understand. And also I'm going to use another date for those who have 21 day cycle. So if you are in the, you have joined me in the live stream and you have a different cycle and you want to know your ovulation day, you can kindly tell me in the comment section so that I help you know your ovulation day and also help you know your safe and fertile days. Let me know who is in the live stream so that, and tell me your cycle so that I can help you have your, or know your ovulation day, your safe days, and your fertile days. Yeah, thank you for those who have joined me live. I appreciate so much. Tell me where you are joining me from, and let us interact in the comment section. If you have any problem, any questions pertaining your ovulation cycle, your cycle, menstrual cycle, ask me in the comment section so that I help you know more about your cycle. Yes, so I'm going to use another cycle for those who have 21 day cycle. For those who have 21 day cycle. So if you have 21 day cycle, to know your ovulation day, just take your cycle, the length of your cycle, subtract 14 days. And the resultant number is your ovulation day. So if you have 21 day cycle, 21 minus 14, you have 7. So 7th is your ovulation day. So I've said, to know your ovulation day, take the length of your cycle, subtract 14. The resultant number is your ovulation day. And your ovulation day is the most fertile day in your cycle. So if you have 21 day cycle, that is very short cycle. You take 21 minus 14, you have 7. So 7th will be your ovulation day. So for example, if you are menstruating for more than 7 days and you have 21 day cycle, if you have sex during this time, even when you are menstruating, you will still be pregnant. There will still be high chances or high probability that you can be pregnant. So if you have 21 day cycle, what are your safe days? I've said you count 5 days to ovulation and 5 days to ovulation and 2 days after ovulation. So 2 days after ovulation, that will be 8th and 9th. 5 days pre-ovulation will have 6th, 5th, 5th, 4th, 3rd. 1, 2, 3, 4, 5. So from 3rd to 7th, so if you have sex from 3rd to 7th, you'll be increasing your chances of being pregnant. And then plus 2 days. So this period between 3rd and 9th, when you have 21 days cycle, is your fertile days for those who have 21 days cycle. For those who are joining me right now, I'm talking about how to calculate your safe days and your fertile days. I've said for you to know your safe days, you must know your ovulation day. And 5 days to your ovulation date plus 2 days after ovulation day, that period is your fertile days. The rest of the days are your safe days. So if you have sex in your safe days, there's low probability that you will be pregnant. Yes. Thank you. For those who have joined me, I want to appreciate you for taking your time to join me live. So if you have 21 days cycle, then your ovulation day is 7th. Your fertile days is between 3rd and 9th. 3rd and 9th. So that period is your fertile days. What are your safe days? Your safe days will be from day 9th to the next time you have your menses. That will be your safe days for people who have 21-day cycle. Anybody who has a different cycle, who has a different length of a cycle, tell me in the comment section so that I help you know your fertile and safe days. For those who have different cycles and you are live, you have joined me live, kindly let me know so that I help you know your ovulation safe days and fertile days. I'm going to use another length. Which length do you want me to use? For those who are watching me live, which length do you want to know? Which length? Okay, let me take 35 days. For those who have longer length, that is 35 days. If you have 35 days cycle, 35 days, I've said after ovulation takes 14 days. So to know your ovulation day, you take the length of your cycle. For example, in that case, it's 35 minus 14. So 35 minus 14, you come to 21. That is, so 21st will be your day of ovulation. If you have 35-day cycle. So 21st will be your day of ovulation. I've said you count 5 days to ovulation plus 2 days of after ovulation. That period will be your safe days. So that one will come to 21, 22nd, 23rd. Up to 23rd, you will come up to 23rd, and then you count 5 days to ovulation. That is 20th. 5 days to ovulation. So ovulation day is 21. So you count 5 days to ovulation plus 2 days after ovulation. So 5 days to ovulation is from 17th to 21st. That's the day of ovulation. And then you add 2 days after ovulation. So this period is your fertile days. That period between 17th to 23rd is your fertile days. So it means that from the first day you see your menses to 17th day, that is your safe days. From 23rd to the next time you see your menses, which is after 35 days, that is again your safe days. So if you don't want to be pregnant, avoid having unprotected sex between 17th and 23rd. Any day you have sex here between these 2 days, you will increase your chances of being pregnant. And if you don't want to, then avoid or use alternative methods like using of condoms or other forms of family planning like pills Yes. So if you have sex between this period, remember, you are increasing your chances of being pregnant. So from the first day of your menses to day 17th, if you have 35-day cycle, this one I'm using an example of those who have 35-day cycle. From first day to day 17th, and also from day 23rd to 35, that is your safe days. So period between these days are your period between the 17th and 23rd, those are your fertile days. So for those who have joined me live and you are wondering what I'm talking about, I don't want you to get lost. Kindly, I'm helping you to know how to calculate your safe days. I'm also helping you know how to know your fertile days. And most importantly, can you know your ovulation day? Your ovulation day is the most fertile day in your window. So you have to locate these days so that you know your safe days or your fertile days. Days around this ovulation day are your fertile days. And I've said 5 days to this ovulation day and 2 days after ovulation day, those are your fertile days. The rest of the days are your safe days. It's very simple to understand, very simple to master, but first you must have regular menstrual period or cycle. Your cycle must be very regular. You must know that it comes after, for example, 28 days. Is it 21 days or after 35 days? You must know that so that you are able to calculate very effectively your safe days and your fertile days. Normally, this education, we are not being taught early enough. Many people have unwanted pregnancies because maybe they were having a myth. One of the myths I've come across, I've heard from ladies, is that you think that some of you were taught that days next to your menses, just days before you see your menses, are your fertile days. That if you have sex just some days to your menstrual day, you will be pregnant, or that is your fertile days. You have to understand that what it means seeing blood or menses. It means that fertilization has not taken place. That ovum is now dead and is being removed or flushed out of the body. That's why you end up seeing your menses, because of failure of fertilization. So those days next to your menses, what days, 2 days or 3 days or how many days, depending on the length of your cycle, those are your safe days. So never ever believe that days next to your menses are fertile days, that if you have sex next to your menses, you'll be pregnant. So that is a myth I've come across. And I believe if you're watching this and maybe you also knew that way, that is wrong. So that maybe you think that if you have sex days before, so many days before, that is the safe days. If you have sex so many days before, there's high likelihood that you'll be playing around the fertile day rather than having sex just next to your menstrual day. So if you have any myth, you've had any myth, kindly ask me right now. This is the time to know the truth about your menstrual cycle. So don't hold any myth and end up maybe getting unwanted, having unwanted pregnancy because you lacked knowledge. So this is the time where we give freely information pertaining menstrual cycle. So if you are joining me kindly, give me a thumbs up and subscribe to my channel so that you are able to get more of this information, more of this health education more frequently. Ignorance is not good. Ignorance, even in the court of law, you cannot defend it, that I didn't know. That's why I got pregnant. Nowadays, social media has given us platform to learn. Yeah. So I'm talking about, before I sign off, let me remind those who are joining me late. I was talking about safe days and fertile days and ovulation day. Those 3 points are very important for anybody who is sexually active. For the young ladies who are still sexually active and are in their reproductive age, kindly, those terms are very, very important. Tell me where you're watching me from. Let me know, my audience. Let us connect. If you are joining me for the first time, my name is Nas Dennis. Let us connect, know each other, support me. Be my audience. Receive my information. If you have any question, ask me. Yeah, I'm here to take your questions. When I was starting, I said that there is no absolute safe days. So things can change. So we have factors that can influence your menstrual cycle. I'm going to talk about them in a few minutes. But first, let me see your questions in the comment section. Let me see your questions, guys. Let me see your questions in the comment section. So in the next few minutes, I'm going to talk about what can make your menstrual cycle change, what can affect your menstrual cycle. So those factors which can easily affect your menstrual cycle is what I'm going to talk about, so that you understand changes. What can lead to you having irregular menses? Irregular menses means you are not able to see your menses after a specific number of days. If it is after 28 days, next time it is after 35, another time is after 21 days. So that is what I'm going to talk about. What can make this cycle be so irregular? Yeah. Kindly, if you have any question, feel free. Let me talk about these factors that can affect your menstrual cycle. Many ladies, one of the most frequent factor, one of the most common factor is stress. Stress plays a big role in your menstrual cycle. stress plays a big role in your menstrual cycle. So if you are stressed, some people when they are stressed, even if their menses or the cycle is not due, they start seeing their menses immediately. So stress can cause variable or variation in your cycle. Stress is one of them. So stress and the menstrual cycle are closely related. So avoid stress. It can be due to stress that you have irregular menstrual cycle. So if you have stress, expect that there can be change in your cycle. We have very many stress coping mechanism to stress. So try to have them. Try to indulge yourself in those coping mechanisms so that you avoid stress. Stress will cause so many problems in your body. Stress is a risk factor to so many health medical conditions. So one of them is stress. Another one is dietary habits. What you eat, the kinds of food you eat. There are foods that will affect your menstrual cycle. Also, smoking. So many areas I've seen smoking as a very serious factor in health. So, and you cannot exempt menstrual cycle. So if you are a smoker, with any kind of smoke, any kind, some people use bang, cocaine, heroin, cigarettes. So smoking can also affect your menstrual cycle. Family history. If in your family you have history of menstrual problems, then it is also possible that you can also be a victim. So if your family history of this abnormal bleeding, abnormal uterine bleeding, heavy menses, here amenorrhea, there are so many types. Amenorrhea, there are people who don't even see their menses. That is called lack of seeing menses is called amenorrhea. Some have painful metrorrhagia, like they have a lot of pain during this time. They have a lot of pain. So such people is like when they're seeing menses, they can't do anything. It affects their daily activities. Others have light bleeding. Light actually should have should be medium, should not be too heavy, because if it is too heavy, then you will lose a lot of blood, you'll become anemic, and that one again will affect your general health. When you are anemic, your body does not get enough blood supply and oxygen. Ethnicity, where you're coming from, is also matters. That one can also play a role in your cycle. So if you're joining me, kindly give me a thumbs up, like my live stream, and let's interact in the comment section. Appreciate everybody who has taken their time to be with me since I started this live stream. So which questions do you have concerning your menstrual cycle? Which questions do you have concerning your menstrual cycle? I don't want to lock anybody out. Let me not lock you out if you have any question. So if you have regular menstrual cycle, it is an important indicator of healthy reproductive system. If you are a woman of reproductive age, then it is very healthy or a good indicator if you have a regular menstrual cycle. So in some previous studies, obesity, stress, smoking, drinking have been associated with irregular menstrual cycle and even can cause early menopause. So these factors are serious and can easily affect your menstrual cycle. But the good thing, these are modifiable risk factors. Modifiable risk factors, these are factors that we can change, habits that you can change. For example, obesity, you can work on your weight. Yesterday, I was talking about obesity in general, what causes obesity, its health risk, it puts you into. So these factors like smoking, drinking, that is alcohol abuse, stress, you can change them for your better health. Remember, we have non-modifiable risk factors, things that we cannot change. One of them is your family history. If you have family history of menstrual problems, that one you cannot change unless you go to the health facility, seek medical attention, then you can be helped. But things we can change on our own, like being obese, those are things we can avoid, problems we can avoid. So anyone with a question, kindly ask me in the comment section. So you guys review your stress management strategies, because you don't want to be having irregular menses, and also you don't want to be associated with early menopause. In early menopause, you will not see your menses, but your age is still in the reproductive bracket. So also tell me what you want to hear from me next in my next live stream. If you are a member, kindly tell me what you want to hear me next presenting to you. I want to tell you things that you want to know, things that are of your concern. I want to appreciate everybody who has participated in this live stream. I know maybe Miss Judy, you've left, but you've been highly supportive of this. Let me say thank you. Anybody who is silent, my silent watcher, if you are watching me silently, kindly take my thank you. Receive my thank you note, because it has been a very successful evening for me. And there's this fact I was talking about. Some people are using different birth control methods. These are hormonal contraceptives. So they can also, to some individuals, they can cause irregular menses or problems with their menstruation. Some people have reported heavy bleeding. Some have reported lack of bleeding. That is what is known as amenorrhea. Some also have reported spotting, time to time spotting. So these problems that they normally occur with the different contraceptives. Remember, these contraceptives, they react differently to different individuals. So someone can be having a heavy bleeding, and maybe she tells you the problem, you think you will also present with the same. You will react differently. Someone's problems does not necessarily relate to your situation. So if you want any accurate information, you rather go to health facilities, see a nurse or a doctor to get explicit new information about all family planning methods, their advantages and disadvantages. Then you can choose the one of your choice. Someone should not choose for you the contraceptive to use. You are the one to listen to all advantages and then disadvantages. We also have indications and contraindications. If you have any if you have a medical problem or condition, then there are some contraceptives that should not be used in such cases. So your doctor will advise you accordingly which contraceptive to use. Because these contraceptives, they also can also affect your health. And there are some conditions that when you have, you should not use some contraceptives. So it has been found that these hormonal contraceptives, they can also affect your menses. Might not necessarily, but to some people, it has affected their menstrual cycle. So if you also have a menstrual change, there is this factor I was going to forget. You might be pregnant. If you fail to see your menses on the date you are expecting, you can also go ahead and check your pregnancy status by doing a pregnancy test. So you can do a self-pregnancy test where you buy urine strip. There are instructions in that urine strip how to use it, or you can visit a health clinic or health center and have you tested for pregnancy. So you can be thinking maybe your menses have delayed and you are pregnant. So don't assume. One of the, is it possible or probable sign of pregnancy is when you miss your menses. So the first thing is to think of pregnancy. So first rule it out and maybe also check on other factors. So if you miss your menses, one of the possible things that you can be pregnant. Another thing can also be breastfeeding. You know, there are hormones. One of them is prolactin hormone, which plays a role in milk production. So they can also suppress ovulation, especially those who are exclusively and frequently breastfeeding during their first months of delivery. So remember, after giving birth, the first 6 weeks, that's the 1 month and 2 weeks, first 6 weeks, this hormone called prolactin helps you to suppress your ovulation. So if you have intercourse between the first 6 weeks of delivery, you cannot be pregnant if you are doing exclusive breastfeeding. But after 6 weeks of delivery, if you have intercourse, you can be pregnant. Just remember being pregnant almost immediately after giving birth, after 6 weeks of delivery. So kindly, to anyone who has given birth, know that after 6 weeks you can be pregnant. But within that 6 week, within the first 6 week, this hormone called prolactin suppresses ovulation. That is what is known as lactation amenorrhea. In the first 6 weeks, you will not see your menses because of a lactation amenorrhea of this hormone called prolactin that suppresses ovulation. So you need to, immediately you deliver baby, you should be able to talk with your doctor on how you can plan. You can have family planning method, which one is appropriate for you, because you should know that after 6 weeks, you can be pregnant again. And pregnancy affects you physiologically, psychologically. So you need time to let your body rest and prepare for the next pregnancy. You should not be able to be pregnant immediately after you've given birth, 1 month after you've given birth. Your body need to rest and go back to normal. Yeah, so that one is also very important. You know about the lactational amenorrhea. After giving birth, how long are you still safe? After how long can you be pregnant? After how long can you be pregnant when you give birth? So there are also some conditions that can affect your regular menstruation. One of them is polycystic ovarian syndrome. So I found that there are some cysts. There are some things called cysts that can grow in your ovaries. So they can stop ovulation, resulting into irregular periods. So this is, they can only be seen when you do ultrasound, abdominal ultrasound. So if you have irregular menstruation, you can be having cysts in your ovaries. So these cysts, they can stop ovulation and cause irregular menstruation. So if you have irregular menstruation, have yourself being checked. Maybe your doctor will recommend ultrasound. In case you have cysts, these are correctable. They can be corrected. There are also medications that can suppress them. Yeah. So irregular menstruation can also be a result of polycystic ovarian syndrome, which is a cyst in your ovaries. You can also be having endometriosis. These are problems in your endometrium. We also have, there are so many. If you have some thyroid conditions like hypothyroidism, those factors can affect your menstrual cycle. If you are underweight, the period can be less regular or you can even stop. And even excessive exercise. So excessive exercise can interfere with can be responsible for menstruation problems, because they can interfere with hormones that are responsible. They can interfere with hormones that are responsible for menstruation. Mostly those who are athletes and females who are dancers who train intensively. So if you are training intensively, you are an athlete, you are a dancer, that exercise, such intensive exercise, can interfere with hormones that are responsible for menstruation. So that can cause menstrual changes. So if you are an athlete, you should train within limits. If you are a woman or you are a dancer, you must have limits. Too much of it can affect your cycle. Yes, I want to say thank you so much, everybody who joined me live. Thank you for being part of this live. I want to appreciate you so much. I love you people, the support that you've given me. And remember to subscribe to my channel. Support me, guys. Yeah, support me. Don't leave without subscribing to my channel. Yes. Give me a thumbs up. And also tomorrow I'll be having another live. I do have them daily between 4 to 5. So if you're free, find time to join me and let us run together. Have a wonderful evening, and may God bless you and keep you until tomorrow. Bye-bye.